Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a nice start to your week. Welcome to the middle of June. Hope you enjoy your day and the rest of the week. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update for Tuesday, June the 15th, 2021. I'm going to look at 6 areas of health and wellness news information today. Somewhere around this video, you can read through all 6 of those areas. If you'd like a copy, if you have any questions, you can DM us on social. You can give us a call here at the clinic or send us an email. We'd be happy to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, you just don't know what that body of yours is capable of when you give it a great environment, and some of the information from the research and literature can help you do just that. All right. So the European Heart Journal, June 2021, came out with an interesting perspective on traffic noise pollution and how it can slightly increase cardiovascular risks. Data from the UK Biobank that they looked at, and they were able to estimate that living in an area with regular exposure to road traffic noise at 65 decibels or higher is associated with small but adverse increases in both blood pressure and triglyceride levels. It'd be interesting to read that report and see what we can extrapolate from that. However, it may be that when you live, not necessarily work, but live in these areas, that noise creates some level of excitation to your body, your nervous system, and doesn't allow it to fully calm down and relax, perhaps, is my perspective. But who knows how or why that may work, and they may not even know, but they were able to draw that conclusion. So good to have a restful environment where you can not only sleep but also engage in things away from work so that your body can take care of itself better instead of always being overstimulated, which is what our environment is very much like these days. So we want to be able to disconnect from some of that stimulation on occasion. Another good thing to do for yourself, of course, is to make sure you're eating well. The journal Clinical Nutrition, May 2021, looked at your fruits and veggies and how they may play a role with stress. According to a new study, there's an association between fruit and vegetable intake and lower stress. The researchers note that vegetables and fruits contain important nutrients such as vitamins, minerals, flavonoids, and carotenoids that can reduce inflammation and oxidative stress and therefore improve mental well-being. Inflammation and oxidative stress in the body are recognized factors that can lead to increased stress, anxiety, and lower mood. These findings encourage more research into diet and specifically what fruits and vegetables provide the most benefits for mental health. Of course, it's good to eat a variety of those fruits and vegetables because they not only contain your vitamins and minerals, but different fruits and vegetables also contain some chemicals that your body utilizes to keep itself healthy, like those flavonoids and carotenoids, but maybe even other potential chemical components that help your body fight things like cancer. So good to get a variety and many things in moderation. Don't overdo one thing. An interesting story yesterday from a patient who shared that they had consumed at one point a very large papaya and in one sitting and kind of stuffed themselves and actually ended up in the ER because the fiber from the papaya created a blockage in their intestinal tract. Very interesting story. So even good things you want to get in moderation. Don't overdo it. All right. But variety is the key there. Yoga is good for children with ADHD. It helps them focus, according to the Biological Psychiatry Report, May 2021. Children with attention deficit hyperactivity disorder, ADHD, who participated in yoga and breathing exercise classes 3 times a week for 3 months, exhibited improvements in attention, decreased hyperactivity, longer levels of alertness, and the ability to engage in complex activities longer. Sounds like we could all benefit from a little bit of yoga. And the key thing with yoga is not necessarily the North Americanized version where there's the goal of stretching or being more limber, which is also okay. But it's really good to focus on the breathing and reconnecting with your body and maybe with source. Just getting into a state of flow with that yoga helps create a physiological benefit from the yoga beyond just the stretching and or holding of the positions. All right. The International Journal of Circumpolar Health, December 2021, talked about depression and it could be a risk factor for early death. An analysis of data from a long-term study found that depression may be as significant a risk factor for premature death as cardiovascular disease. So our mental health and wellness, our cognitive function, very important to live a good, maybe long life, but especially a good quality life. So if you're not feeling like yourself, good to seek out some advice, some help, and some care from a qualified healthcare provider or otherwise to make sure that we're taking care of ourselves, not just physically in our parts, but also how we feel, how we think, our mood, and so forth. Very vital part of our overall health and wellness. The Penn State Health report from April 2021 looked at warning signs for a heart defect in children. They talked about such things as blue lips, changes in feeding behavior, and excessive sweating after feeding. That's what we might notice in babies. In young children and teens, we might notice things like exercise intolerance, dizziness, and chest pains. So all of these symptoms, if you notice them from the very young to the little bit older youth, always good to make sure you seek out the advice of a qualified healthcare provider about those symptoms. Okay? And then finally, Scientific Reports, May 2021, looked at spinal pain and how it may increase weight in school-aged children. They looked at a study and it suggested that spinal pain may be a risk factor for obesity in younger teens. In this study, researchers found that preteens who had spinal pain were over 3 times more likely to become overweight over the following 2 years, particularly those with more frequent pain episodes or pain in more than one region of the spine. That discomfort, as we know, regardless of age, keeps us from doing things that we'd like to be doing in terms of activities because the pain just doesn't allow us to do it or we don't enjoy it as much. Plus, pain itself is just very draining, can contribute to our overall thinking challenges as well as depression or mood changes, and that keeps us from wanting to be active or do things as well. So good to seek out care for those aches and pains. Sometimes younger people don't articulate or vocalize some of their discomfort in the same way that an older person would. So good to stay in touch with them, communicate with them, see how they're doing, and if there are any concerns, even if they seem minor, good to address them so that they don't contribute to challenges in lifestyle and development at any age. Okay, so that's your daily health update for Tuesday. Some good news from the research and literature out there when it comes to your health and wellness. We'll be back tomorrow, Wednesday, keeping an eye on and helping support you with your health and wellness journey. Enjoy your day today. Go share some smiles, take care of yourself, and make it a good one. All the best.